on in, take a seat. My name is Lee and I am the medical assistant that will just gather your patient information, take your vital signs, and just prep you right before the provider comes in to see you. If you wouldn't mind confirming your appointment time for me. All right. Yes, yep. I see you on the sheet. You're all set. Thank you for coming on time. We so appreciate it. Now let me just pull up your demographics. If you can confirm your date of birth for me. Yep, I got you in there. Now the appointment type reason, what is bringing you in today? You delivered about 2-3 months ago, okay? An area of your breast is tender. Yeah, I completely understand. Are you breastfeeding? You are, okay. That is no problem. We will get that figured out for you. Does it look infected? It's a bit red and tender, okay? Okay, and how are you feeling as far as like fever, chills? You've been feeling a little bit warm? No problem. I am going to be doing a temperature check anyway. Now, as far as current medical conditions, you look like you're overall very healthy. Are you on any medications at this time? Okay. And any new surgeries? Do you smoke or drink alcohol? How often? Okay. Relationship status at this time? Single, relationship, married? Okay. Male partner? Okay. All right. And approximately how long or how many days or hours do you think this has been going on for? Happened last night? Okay. Yeah, no, I'm just super happy that we were able to get you in. Oh yeah, no, I can't even imagine. All right, and is it just one breast? Gotcha. Okay, I'm gonna finish checking you into the system. Then I will get your vital signs, and then Leanna, the PA, will come in to do the examination. Are you comfortable with her examining? Okay, awesome. We just have to ask in case you weren't expecting it for whatever reason. Okay. Do you know how tall you are approximately? Okay. All right, I think I have everything that I need as far as what's in the system. Now I'm just going to write your vital signs down on your patient sheet, and then we'll get everything going for you, okay? Yes, we will definitely take good care of you. All right, how about we start with some blood pressure? Any history of white coat syndrome or anything I should know about with that? Okay. If it works for you, I was just going to use this arm over here. If you can keep your feet flat and uncrossed. Does that feel secure? Good. Good. If you can give me 1 second. Take this off of here. I am just going to write that down. Blood pressure wasn't high at all. Completely normal. 117/84. next thing that we are going to be doing is just a temperature check, if that's okay. Good. All right. Yeah, I've had some patients tell me that when I take the blood pressure, it's a little bit too loud, so I was trying to be more aware of it. It was okay this time? Good, good, good. All right, this is gonna go underneath your tongue. All right. And how has the breastfeeding been going? Yes, yeah. I haven't been pregnant before, but I understand why you'd say something like that. Yeah. Okay. So, we've got all of the necessary notes that we need for Leanna the PA. So basically what's going to happen, if it is okay with you, is I am going to be giving you a drape. You could keep everything bottom-wise on, but if you wouldn't mind just taking off your top, and then you can cover your whole front with the drape. You'll be in a laid back position. Lena the PA is just going to want to take a look at both breasts and just compare the two and rule out signs of infection or abscess or anything like that. I'm going to leave this drape with you here. I'm going to give you some privacy, and Lena the PA will be in to do your breast exam. No problem at all. I hope you feel better. I'll give you some privacy now. Hello, it is nice to see you. I heard this breast was experiencing redness and tenderness. Okay, and is there any drainage at the site at all? Understood. And are you still breastfeeding at this time? Feels pretty engorged. Okay, yes, no problem at all. If it's okay with you, I will be examining the breast that isn't having those symptoms, just as a side-by-side comparison, and then I will be examining this one. I do apologize in advance if it's very uncomfortable, but I definitely just want to get that diagnosis for you so we can get you feeling better. You're okay with that? Thank you, thank you, thank you. I'm gonna grab some gloves here. Okay. How is your baby doing? Good. And how have you been overall? Do you have good support around you at home? Good, good. That's what I want to hear. Alright, so what I'm going to do, if it's okay with you, I'm just going to lift this side here to expose one breast at a time. I'm going to feel my hands. Do you mind lifting the arm a little bit? Okay, and then no problems at all with this one, right? Good, good, good. On any medications or supplements at this time? Okay. Okay, just gonna take a quick pen light just to kind of shine a light in the area. This breast we are done examining, so we're all good to go on that side. And so I am going to lift this side now, okay? Okay. Again, I apologize if it's very uncomfortable. Just move this a little bit more. Yeah, I definitely see that area you're talking about. definitely looks red, gorged. I'm going to press on it just a little bit. Tender. Yeah. Okay. The good news is it doesn't look, super infected like an abscess or anything. Okay. What I'm going to do is just make 2 little marks so I can measure the site. Just look at it with the light here. Just gonna measure it so we can put in your records. Have you tried doing anything at home at all to help with the pain? You just came straight in. Yeah, no, that is no problem. If you wouldn't mind lifting this arm now, just to take a look. Alright, well, I think I know exactly what is going on. I am going to cover you up here, and I want to just grab you some patient information that I actually brought in. So, with that being said, have you ever heard of the condition called mastitis? Sounds pretty familiar. Yes, so let me grab this notepad here so we can kind of go over everything, and I'm going to make sure you have all the printouts, by the way. The thing with mastitis, it's actually one of the most common complications associated with breastfeeding. Yes, yeah, we actually see it quite frequently. Usually it's due to poor milk drainage. Now what can happen in that situation is really we have to do our best to express that milk. So although it may not seem like what you would do is breastfeed continuously from that side, that is what you're going to want to do. So keep breastfeeding both sides. As far as helping with pain, Tylenol or Motrin are both okay. If you want, I can send over Tylenol for you. Okay. You'll want to try and wear loose-fitting bras. Warm compresses or hot showers, even cold compresses on the affected breast will help you. There is an antibiotic I want to send you just because you did have a mild fever. Now, please know that this antibiotic is safe to use while breastfeeding, and so you'll definitely still keep wanting to express from that side. You can continue to breastfeed or pump, whichever is your preferred method. I am going to send you with the antibiotics that I really want you to start just to prevent further infection, okay? Yes, and after starting the antibiotics, the compresses, the pain medication, you should be feeling a lot better. Yes, now I need you to do me a favor though. If you don't feel a lot better within the next few days, I need you to call me immediately, even tomorrow if you feel like things are getting worse after starting the antibiotic. Yes, yep, the condition is called mastitis. Exactly. So what I am going to do, if it's okay with you, I'm going to give you some privacy. You can get dressed again. The girls will see you at checkout. I'm going to make sure at checkout they have your antibiotics available to you. We'll get you started on that. And if you have any further questions or concerns, please do not hesitate to call me. You are so very welcome. You have a good rest of your day, and I hope you feel better. My pleasure.